I'm Wendy Garner with Children's of Alabama. Today we're talking about something a parent never wants to see in their child's eyes. It's pink eye. Joining me right now is Dr. Christina Fettig, who is a pediatrician at Mayfair Medical Group in Homewood. So good to see you.
Thank you. It's great seeing you.
This is common, and obviously it speaks for itself, pink eye, but what are some of the other symptoms?
So pink eye, just to start, is an inflammation of the eye and the lining of the eye, which is the conjunctiva. So the fancy term for pink eye, conjunctivitis. The most common symptoms of pink eye are going to be pink of the eye. Certainly you can see some discomfort as well as some tearing or draining from the eye.
Okay, and they may feel like there's sand in their eye as well.
Absolutely, yes.
I always thought pink eye was highly contagious, but that's not always the case. Is that right?
Very true. So there are 4 different types of pink eye, 2 of which are contagious and 2 that are not. So the most common type of pink eye is actually viral pink eye, which there's not too much that we can do about, but it's often accompanied by the common cold. We also see bacterial pink eye very commonly in children, which can be treated with some eye drops. And then there are 2 types of pink eye that aren't contagious. One of those being an allergic pink eye, more prone in children with allergies, especially seasonal or environmental allergies, as well as irritant pink eye. And an example of that would be a child swimming in chlorinated water and coming out with pink red eye.
Right, and I guess that's a reason why parents should always take their child to see their pediatrician when they think they may have pink eye to discern which type it is.
You're
right?
exactly right. It is important, especially with bacterial pink eye. If started early enough, eye drops can decrease the duration of symptoms, and so you're exactly right. It's very important to see your pediatrician.
Is there any way to prevent this?
Great question. Frequent hand washing is very important. So parents, especially after putting drops in children's eyes, should make sure that they've washed their hands. And of course, it's always important for children to keep their hands washed as best as they can, and alcohol sanitizer around is always a great idea as well.
A good reminder to prevent a lot of illnesses,
Absolutely.
including pink eye. Dr.
Yes.
Fettig from Mayfair Medical Group, thank you so much
You're
for sharing some
welcome.
good tips. And for more information, you can go to the Children's website at childrensal.org.